Beyond Lucid Technology, we move data to help medics and hospitals achieve max efficiency, even during a disaster.
Today we're going to go through the MEDIVIEW Thrive system. This is a system designed to track your patients within your community paramedicine or mobile integrated healthcare system. This is our main login screen here. And once we log in, we're going to go through some of the features of this platform. So when we first come in, you will notice that there is, let's hide that there's our main screen, right? This right now is blank because we haven't searched for anything. We're going to come over here. We're going to do a quick search. And this just pulls up all of our patients that are within our system, right? So these are not individual patient encounters, but these are patients with all of their encounters rolled up underneath them. And we're going to go into some of those and how that works right now. So let's go in here first. We're going to search for my information. So I'm going to come right over here to my search window here. And I'm going to search for, oops, wrong keyboard. I'm going to search for my information. And we're going to do a quick search. Now you will see I am in here as 4 different patients, right? And this, again, is just for demonstration purposes. But if I come over here and I'm going to look at a summary for one of these. So let's start at this top one here. So if I pull up this summary, this is going to give you the basic information about me. So there's name, date of birth, my age, gender, race if it's been recorded, our patient ID, that's patient ID within the system, phone number, default address, who's assigned to take care of me in our MIH program, and who's our backup personnel. We're going to cover that in a minute. And if there's any program enrollments, and again, we'll cover those as well. And I can add enrollments here, which we'll talk about enrollment shortly. There's my chart history. So this is any charts that are associated with me. So let's say that I have been seen by 911. Now here, there's none in this one. We're going to go through another profile. It's going to show you a bunch, but this is where you would find any of the charts for encounters that happened during your MIH encounter, but that also could have happened on the 911 side of your system. So you can put them all together under one to be able to look at the total chart history and then be able to track some of the things that happen within these patients, whether we're looking at vitals over time, symptoms, medications, history, allergies, social determinants of health. We can track all of those over time in these charts. Now, there's no charts here, but let's say I wanted to find, I know there should be some, so I'm going to go to chart search, right? So this is where I can search my system and find out if there are charts in there for me that have not been linked. So you'll notice there's a whole bunch of charts in here that are not linked to any records, right? So these, you'll see here, these are displaying 19 unlinked charts. And you'll notice I searched my last name. Now you'll see there's one with my first and last name, one with my first, middle, and last name. There are some charts in here with Art, which is what I go by, but not my legal name and my last name. Some of them have a partial address. Some of them have a full address. Some of them have different states. So if you have a patient that, like in my case, if I go by Art, but my name is Arthur, so sometimes your crew may have recorded my name as Art. They may have recorded it as Arthur. They may have recorded Arthur Richard Grew. You can link all of those different spellings, as long as you know they're the same patient, together under one profile. So instead of having to go back and update the names in every chart, you don't have to. You can link these all together under one profile. And the way we do that here is we search for the last name. I could search for just date of birth if I wanted to. I could search for social security number. I could search for patient ID. I can choose different date ranges if I wanted to. But when I find them, all I do is I come over here and I just click link. Okay. So we're gonna link a few of these, right? So let's link a couple of these to this record. So now when I go to my chart history, oops, let's go to all dates. So now those 3 charts that I linked are all attached to the record here, right? So, and if I wanted to, I can go through, I can do a bunch of things with them. If I click on my little drop down here, so this is going to come over, I can go over, I can open the chart if I wanted to, I can attach documents to it. If I wanted to view the PDF of the record, I can do that right here. So this is it's going to go back and pull up the record. I can look and see what was recorded for this encounter. I can get the information out of there. In this case, there was some documentation that was attached with a photo, so you could see those photos as well attached to it. And then I can just click here. I can go back to summary. And again, this goes to chart history. The next thing is action items. Action items is where we can assign certain things or activities that need to happen. So if I want to add an action item, my task description might be here is phone call. Okay, so we don't know what the duration is. The status for this is we're going to say it's pending, okay? Because at this point, we want somebody to do it, right? So the task type here, we're going to call this a phone call. So the date created is today. We're going to put the due date. We're going to put the due date as the next day. Date completed. You'll notice here, date completed is blank at this point. We want to keep that blank for now. So we're going to say the patient's last name is, in this case, we're going to make patient's last name Smith, right? We're not going to record any other information, but if I had a report number, I could put that in. If I knew their date of birth, if I knew other stuff. And we're going to assign this to me. So I can also add in other information about that person if I don't know it. If I click on this little box here, it's going to pull up all of our staff. So I could assign it to whoever I wanted within the staff list if I wanted to. I could put the contact's first and last name, and I can put comments, right? So the contact, maybe you want them to follow up with a family member because this patient needs some additional services and the patient is not in the mental capacity to make the decision for themselves. So you could put that in there, and let's pay, we're going to put a note here, follow up with family regarding social services. Okay. I can use my GPS location if I wanted to put that. So let's say I'm at the patient's home. I can just tag that. I can put the location name if I wanted to, address. There's a bunch of fields we can put here, right? And these don't all have to be used, right? So in this case, we only put in 4 things, right? So we save those 4 things. So now we come back. That action item is now saved, okay? So that action item, and you'll see it right here. So there it's saved right here. So if I wanted to go in now and I want to update, I made that phone call, I want to update the status. So maybe I made a phone call and left a voicemail. I'm going to put this as in progress, okay? So now I know somebody can go in, they can look that it's in progress. They can also look and filter, by crew member. So if I wanted to put in just to see how many action items for GRU or outstanding, I can do that. Okay. I can do it by patient name. So I can filter these by patient name. I can look at just all the charts or all the action items that are in progress. I can change the date range of my search. I can do a bunch of things. But you'll notice this one right here was assigned to Art. Now, let's say I left a voicemail, but I am not going to be in tomorrow. And I need somebody to make another call tomorrow. So I can click on assign to, and let's say that Santa Claus is my relief in the MIH program tomorrow. So I'm going to assign it to Santa Claus. So now tomorrow, when Santa Claus comes in and he can do a quick search of all the action items assigned to him, he's going to see this on there. And he can go in, he can make notes just by clicking edit. He can add to the notes, or he can go in and create a chart out of it. So there's a bunch of things that can be done here, right? So you can also assign it to a facility. So if your MIH program contains personnel from multiple facilities, you can assign that to one facility or another facility just by going to assign to facility. So it will pull up a list. So if I want the MIH program that's coming out of Rampart to have it, I can assign it to them. So let's say I don't know who the provider is going to be that's going to hop on that. I can just assign it to the facility. I could also assign it to a station. So if your MIH program is coming out of multiple facility or multiple stations, under those facilities, we can add in stations and you can assign it to them as well. Now, we can also assign it to backup, under your patients, we can do the same thing. So if I come back over here and I look at this, and I'm going to click on art here again, and I can do assign to. You'll notice I can assign to personnel, or I can assign to a station, and I can assign to backup personnel. So let's say that Art's primary person that's going to see him is going to be Santa Claus. So I can just click on Santa Claus and hit confirm. But I also need a backup personnel because some days Art's on vacation or his shift rotation may not hit everyone. So or every day that patient needs to be seen. So I can go to backup personnel and I can assign them to, a backup personnel. So in this case, who do we want to assign them to? We are going to assign them to, we'll assign them to test, right? We're going to assign them to test. So now, if I wanted to see all the patients that are assigned to me, I can go down and look at the assignee. I can just choose. So if I want to see everyone that's assigned to Santa Claus, I can just do a search and see everybody that's assigned to Santa Claus. In this case, I'm also looking at the last name of Gru, right? So let's get rid of that. Okay. So now I'm looking for all the patients that are assigned to Santa Claus. In this case, apparently there is only one, and that is me. So your staff can go in and do a search of all the patients assigned to them. They can look at the patients that are assigned to a particular station. They can look at action items that are assigned to particular stations, locations, personnel as well. So this is just how do we do the actual management of the patients, right? So now you have a new patient that's coming in. So I'm going to come over here and I am going to create a new profile. I click on my new profile, I click on it. And in this case, this is a patient where maybe I got a name and a phone number from a hospital or from maybe my regional mental health provider. I didn't get any other information. So I'm going to start my intake. So I pull up this screen, I give them a call, and I start putting in their information while I'm going through. And then when I'm done, I just hit save. And you'll notice here, there's patient demographics, there's additional demographics, contact information. So in the event that you're doing this on location, right? Maybe you got that information out of your dispatch system. You can use the incident location. Maybe you showed up there to do it. There's, physician information. We have closest relative, insurance, employer. Under health, you can do their current health. We're going to do their past medical history. We have allergies, meds and prescriptions, reproductive health. And then under care and support, we have social interventions. Okay. So this gets into our social determinants of health here. Necessity. This is if there is a medical necessity, or let's say you need a physician statement in order to be able to bill under your MIH program, you can get that here. Harmful habits, and we have screenings in here as well. Diet and exercise, and with your MIH patients for long-term, this is important, right? Are they eating appropriately? Are they exercising appropriately? And then under administrative, this is where you can uh, assign them to a program and a facility and their closest facility. So this is important because let's say that your primary facility you assign let's say you have John Doe as your patient who happens to be one of your frequent utilizers in your system that's been assigned to your MIH program, and you assign them to a facility in here. This way, when they call 911 and your 911 provider picks them up and they have the ability to go in and search, or another MIH provider is with them, they don't start asking to go to multiple hospitals, right? So they're not jumping from facility to facility and the information doesn't travel with them as well. You can select a primary facility. So this is kind of like that care plan when you look at, John Doe is always going to go to hospital A because hospital A is familiar with him. They understand his needs, but they also understand his wants, so they can address them appropriately. So this is where that assigning to a facility can become important. And it may not be closest facility, right? So this, particularly if you're in a city system where there's multiple facilities that are within close proximity to each other. You can add in medical record numbers, you can add in a bunch of other information, but we can also add in programs. And this is something that, we can set up program names for you on the admin side. And this is where you get into those program enrollments. So if you have a patient that's being seen under a mental health grant, and maybe they also happen to be a frequent flyer, and they also happen to be somebody who has a substance use disorder, right? And you can have 3 separate programs built around those, and a patient can be assigned to one or multiple programs. So let's say that you've assigned them to your substance use disorder program, your frequent utilizer program, and your um, a regional mental health program. And then as they're being seen under the regional mental health program, their utilization of 911 has dropped, right? So you've had 6 months of data where they haven't used 911. You can graduate them from that frequent utilizer program and still keep them enrolled in the other 2. And we can record the date that they've kind of graduated from one program, so you can show an actual chain of improvement in the patient's utilization of the 911 system, right? So you can show that you have these, let's say, 5 patients that fall under a frequent utilizer system or definition. And over the course of 6 months of MIH care, 5 of these patients have graduated from that program because they haven't used 911 or have only used it, X number of times in that 6-month period. And that type of data is what's going to drive the funding for your program. So once I've done with this, I could just go in and I can save my changes. And so now my patient is enrolled. There's also, let's say your patient is seen by a 911 provider, right? And it doesn't matter if you're using our system for your 911 side or somebody else's system. We can import the data. It doesn't matter, right? So let's say, you're on Image Trend and your 911 crew goes out, they see this patient, and you get an email saying, hey, you need to take a look at John Doe because we went to his house 3 times in the past 24 hours. He's got some issues that we think social services might be able to help and the MIH program might be able to help with. So you can go in under action items, and we're going to create from a PCR record. So in this case, I use John Doe. It's a bad example. I don't have a John Doe chart in here, but let's say I do have a GRU chart in. I could put in, as much information as I have. I can look at the date ranges. So if I know it happened this week, I could just look at this week. I could look at all dates, and I can search records. So as I search records here and it comes up, I can just go over here, and let's say it's this one. I can select it, and it imports the data into the profile. So it now created a profile with the information that was in the chart. And oops. So, and I can save as I go through it. But if there was, other information that was recorded, this stuff all gets saved within the system. So that is how we get new profiles into the system, right? So whether they're coming in from, whether they're coming in from a PCR or you're inputting them, directly. There's also the ability to create from your agency personnel. So if you're using this MIH program to also care for patient or for providers who, let's say, we have another COVID outbreak, or you're recording vaccinations that maybe your program needs to have, you can create a profile from your agency roster. So if I go over here and I click on my agency personnel roster, it will pull up all the information, and I can just click on them, click on the one I want. I can confirm, or I can select all. So if I select all and just hit confirm, it now has created a profile for every one of my employees. And I can start recording that information. So if I have particular information I need to record, I can put that in there. And then you can, again, track that over time. Right? So the other things at the top is charts. If I click on charts, that brings me into the charting aspect of the program. We'll cover that in a different video. Action items we covered. Training brings you to our training site, where you can find videos about how our systems work. And then the last one here is help. Anytime that you have an issue, right? You have a question, you're asking for some kind of improvement to the system. If you click on this help button, it will bring up a form that you can go in and you can submit what it is that you have. If you have pictures, if there's a particular record number that you're having a question about, please provide as much information here as you can, including, your name, your company name, email, phone number is great, because a lot of times we'll have questions. We want to know a little bit more about not only what the issue was, but particularly if you have an improvement suggestion, what is that? How does it work? So put as much information there as you can. As soon as you hit submit on those help tickets, that notifies our entire team, right? Because we want to make sure that none of your requests fall through the cracks or don't get answered as quickly as possible. So please look for our next video. That will show you how the charts section works. And we're going to get into, that carries you over to our MEDIVIEW beacon system, where you can start to see the individual charts, right? So remember, Thrive looked at the patients as a whole, right? So that's where we aggregate the data from all of the different charts under one patient. Our beacon platform is where we look at charts on an individual basis. This is where you can look at each individual interaction. We can do QA process, and data gets moved along to health information exchanges and others through our beacon platform, and watch for that video as well. Thank you very much for watching this today, and we look forward to working with you.